Hello and welcome to the day's episode of Focus Atlanta. I'm your host, Keisha Lancelin. Thanks so much for tuning in with us this week. In our first segment, we're going to talk a little bit about mental health and female veterans. In fact, I'm here with Naomi. Hi, thanks so much for coming on the show.
Thank you so much for having me.
Absolutely. Well, can we start off talking a little about maybe the typical roles women have in serving in the military?
Sure. Well, women have been serving in the military since the Revolutionary War when they weren't supposed to, and they were dressing up as men, right? They're the only all-volunteer force that's ever served our country, and they are growing at a fast rate. They're the fastest growing demographic within the veteran community, with over 650,000 women veterans that are using the VA healthcare facilities. And so DAV commissioned a report titled Women Veterans, The Journey to Mental Wellness. And it is a comprehensive look at risk factors contributing to the staggering suicide rate among women veterans and how VA can do better. It identified gaps in care and offers more than 55 legislative and policy recommendations that can be implemented to save women veterans' lives.
Wow. Can we talk a little more in depth about the numbers, about the number of women who attempt suicide, the number of female veterans?
Sure. Sadly, there was an increase, more than 24% increase of women veterans that have taken their life by suicide. And that is that's 4 times higher than male veterans and vastly higher than their civilian counterparts. And there's some unique challenges, though, that kind of factor into that.
Is there anything that we can do? Knowing the numbers are one thing, but how can we as a community wrap our arms around our females who have served?
Well, one of the things is they can go to, if they want to see the full report and the policy recommendations, they can go to womenveterans.org. There's also access to resources on how you can get involved and help us in this fight to make sure that not another woman veteran's life is taken by suicide.
To that end, are there any policy recommendations? Are there any things that we could advocate for on a higher level?
Well, overall, DAV found gaps in access in their community care provider training, in gender-tailored care, suicide prevention efforts. So one of those gaps, for example, is an innovative model, predictive model that VA uses. And it unfortunately uses a male normative baseline. And it does not include things like military sexual trauma. And so those are one of the gaps that we have identified. And the policy recommendation to that would be that VA ensures that women veterans are included in that algorithm, and definitely that it includes things like military sexual trauma.
Absolutely. Naomi, I can't thank you enough for coming on and sharing all this information. Can we close out with a website where, again, we can view the report, we can learn more?
To find the full report and our policy recommendations, they can go to womenveterans.org.
Thanks so much for your time. It was a pleasure to meet you.
Thank you again for having me, Keisha. Good to see Atlanta.
Absolutely. All right, guys, we can play a role. We can perhaps step up to the plate and be a source of need, a source of resource for our female veterans. Take the opportunity to learn more and stay tuned to more Focus Atlanta. We'll be right back.